All right, here we go from Punta Gorda, Florida, Fru.
Welcome to the Dr. PhilGood Show.
I mean, we missed the blizzard.
This is our weekly broadcast on trauma recovery, cellular health, and real-life healing from the inside out.
Thanks. I have to steal our guest script. I left mine over there.
This series is proudly sponsored by the Patrick Risha CTE Awareness Foundation,
whose mission is to prevent CTE through education and early intervention.
A mission that's critical for families navigating brain injuries.
Much like ours, behavioral changes and long-term caregiving.
Please visit
them at stopcte.org.
Phenomenal. Well, we have a very, very special guest today, and we're so grateful for having Dr. Mizyl Damayo here with us.
Awesome. Very first guest.
Very, very first guest at Dr. PhilGood Show.
We've done this show for a whole year without anybody in it.
Really?
Yeah.
Okay, well, I'm honored.
Yes.
Well, thank you for being
Thank you for being
here.
here. We're honored.
For those of you who don't know her, she's a board-certified psychiatrist specializing in precision psychiatry and integrative approaches to mental health.
She's the founder of the Brainwell program, which uses genetic and lab data to discover root causes of psychiatric symptoms rather than just treating them.
And part of a clinical network influenced by
Dr. Mark
Gordon's work in neuroendocrinology and TBI protocols, emphasizing that many psychiatric issues have biological and very measurable basis.
You and David, Fru, are deeply grateful.
We are deeply
for
grateful.
her partnership in my healing journey. That's what happens. Sometimes I get trapped into this stuff. I was. Thanks.
Well, and that's exactly why we have her here. And
there's
also,
genetic evaluation plus nutrition support and personalized planning.
Oh, sorry.
We got a book this big.
On you.
On me.
Yes. Yes.
Yeah, on him and on you. And
Yeah.
It's the Brainwell program came with a Bible.
Yes.
Yeah.
Yes.
You read through it.
I did.
I didn't. I
well,
said, read it for me.
Well, we're going to talk about that a little bit.
It was really intricate.
As well, but I am really intrigued by this term, precision psychiatry. Mm-hmm. So would you tell us a little bit about what that means with your own words?
Yeah, it's very interesting because I didn't even know I was practicing precision psychiatry.
Oh, really?
Yeah, it's a new term. It was created by these think tanks in Harvard. And I just got into this situation where, like, I know there has to be a root cause for mental health. Why is it my patients are not getting better? So we had to look at genetics, look at labs, look at nutrition, and then looking at hormones. And so now I can tell people, like, okay, these are the things you need to take. These are the things you don't need. You need to focus on this and focus on that. So when you practice with precision, that's what you can tell your patients, so they're not wasting their time and money, and you get to the point of what is the problem.
It's kind of advanced from early 1900s doctors, where they came to the home and saw the environment and saw, it's going back that way, but also you got the advance of genetic testing, right?
Yeah, it's really taking biomarkers. I guess is the best thing to describe that, with genetics and labs and hormones, and then coming up with a solution to how to treat all those things, because you have to look at things holistically. Otherwise, you're treating piecemeal, which I think is a problem, because one person is just looking at one thing without realizing some of those things this is affecting here, because it's the mind and body connection, the gut and brain connection. Any kind of illness causes inflammation, and inflammation causes mental illness by decreasing all the issues of what is controlling your mental health, your neurotransmitters. So I look at the data. I want to know what I'm working with. And then we come up with a plan. And when you're talking about that 40, 50-page plan, that every patient gets when they are part of the Brainwell program.
Well, I expect it to be that big. I just did a business plan for the NeuroHaven idea, and then it's 50-something pages.
And you're like, who's going to read this? We need to hire somebody to
we have
read
to
this.
be in depth for the investors.
Yes.
And
Well, anytime if you want to do something seriously, you have to get down to the roots, right?
so it's the coolest experience. I was just saying earlier before we started recording that I swore never to see another psychiatrist after I saw them for 8 years, and what they did was douse me with medicine, and they hurt me. The last psychiatrist I saw before you, he was a TBI specialist and a psychiatrist. He had both that specialty in his schooling, I suppose. I'd made him different, and so I'd already gone 4 years without seeing one. I said I wouldn't do it anymore. I kept having suicide like crazy the first 3 years. My dad and mom told me I had to go, or they were going to file with the state that I get put in a state hospital because I was very dangerous. And so that's when I said, okay, I'll go. I wasn't gonna ever see a psychiatrist. I just didn't believe I didn't
In
like
the
the fact that
hospital.
if I saw a doctor, they said I was bipolar, and I go, why? And they said, because you're grandiose. And I'm like, what? Tell me the meaning behind that. And they said, godlike. I'm like, you're trying to tell me something about me, and you don't know nothing about me. Talk to me for 2 minutes. So that's why I didn't like psychiatry. But then when this guy, the last guy that I saw, he said, I can't help you. He listened to me for 2 hours. He said, I can help you get off all those psychiatric drugs that they had me on. And he said that you were on a lethal dose of 2. And it should have never been a combination of those 2. And I will apologize for the psychiatric medicine that did this to you. He said, if you wouldn't have had head injuries, he's the first person that told me if I wouldn't even have had head injuries, I would have been dealing with this. But he said it was due to the medicine they were giving me. And he weaned me off that psychiatric pile of medicine I was on and then cut me loose. He said, I can't do anything for you. That's where I heard about CTE. And he told me, you have what CTE, the stage 4 CTE symptoms. You've listed more than 4 or 5 of them in this conversation. And he did all my history. He sit and listened to me for almost 2 hours.
So he helped you, just not in the same
Yeah,
way.
he helped me. He just didn't have any answers.
Right.
He said, I can't help you. There's no place that has anything that helps CTE. It's a disease that is incurable, and you're only going to get worse. He said, the good thing you got going for you is that you've survived this long. That's all he said. He said, you've survived a bunch of suicide attempts, and you've been on these drugs for this long,
yes.
and you're still here. He said,
Yes.
so you got that going for you, but nothing I can tell you is good.
So we know, we haven't talked about it yet, but we know how precision psychiatry helped David. But how would precision psychiatry help somebody with, for example, depression or anxiety?
Yeah, it still goes back to trying to figure out the root cause of things. Because I always believe there is. Because I can honestly say that I've run these labs and so many people, something always comes up.
And are there typical patterns that you see among your patients?
You know what's funny you say that, because no, everybody's different. That's what I love about the practice, because there are some similarities, and I see some people with similar genes, but then they're dealing with different things. So everybody gets a different approach. And what I love about that is the fact that, I can tell people this is why you're feeling bad.
Yeah, that's a big deal.
That helps
That's a big
lot.
deal. Do you know how good I felt when our first conversation after my genetic test come back?
Just knowing.
Just to know, because I had questions about me all my life. Like, why? I want to get to that at some point. I didn't see her script yet, but I want to get to where you're telling everybody why I am the way I am. But
So would you say that your work is focusing on the biology behind all the psychiatric problems, or do you see yourself more helping people with certain issues like TBI or
The beauty of what I do is that it can help anyone, really. Whether what happens is anybody who has a mental illness, it's because their brain is not healthy, and we have to figure out why that's happening, and also why people have a predisposition to mental illness. Because you can give all the meds you want, but if you don't know what you're working with, then you don't know what exactly to replace or supplement or fix,
Right.
other than just throwing a bunch of meds.
This is important that you said that, because when you know, 8 years of psychiatric treatment, I had done every psychiatric drug for bipolar. They all just kept trying all kinds of stuff on me, but your first meeting, you're able to look at, say, this drug wouldn't work for you. Matter of fact, this drug would make you this way. And by looking at my genetics, it makes it. I'm like, why don't every psychiatrist do this? And you said, what? Psychiatrists that think I'm crazy for doing it. Right?
Yeah, you know.
I'll fight them.
Yes, you know, it's we have been taught a certain way. I mean, that's how I was taught in residency. Look at all the meds they've tried and figure out which ones they haven't and throw it there.
Really? That's what I thought. I thought that. I said it had to be that way. They had to have been taught to do that.
Yeah.
it's like dermatology. It sounds
Yeah,
to me. Like, here, try this. Didn't work. All right, try this.
Yeah, but I really believe that we are beyond that. And I think we have to start using
It's
the
changing,
tools.
isn't it?
Yes.
You know, slowly. You know,
Yes.
there's still traditionalists out there, which
I think this is part of Jesus coming back. I mean, I'm serious. It's a big shift.
well, we can talk about that too. But, you know,
Different
Show's
podcast.
not about that.
Different podcast.
yeah.
So please walk us through what a typical initial evaluation looks like,
Yeah.
so that if somebody wants to come to see you, what would they experience at first?
Yeah, you know, I just want to hear their story first.
Wow,
You know,
very different.
I want to hear, like, how did you come here? How did you know to come here? I'm always curious about that. And then also, like, how do you want to feel? You know, how do you see
What does
yourself?
feel good feel like to you? Look like? Yeah.
Yeah, what are your goals? Why are you coming here? Instead of just like, you know, here's another med for you to try. Because I like to be honest, by the time they come to see me, they've been on lots of stuff.
Yeah.
Right.
Yeah. And it's kind of sad that I'm the last resort for these people.
Right.
But
I'm glad you're here, though. I mean, goodness.
yeah, but I guess people have to go through that, because if you're doing well on Zoloft, 25 milligrams, and you do that all your life and it doesn't give you side effects and you'd rather be on it, and you're doing fine, then, you know, that's not what I do. And they can continue to do that with whoever wants to refill their meds. But I'm here if you're interested in, you know, I really don't want to be on that medicine anymore. Can you help me, doc? I said, okay, but I got to have you do these things. Got your genetics, run your labs, hormones, inflammation markers, and you got to do some things that I may still need for you to do beyond that.
Lifestyle medicine.
Yeah, lifestyle medicine, but also like dig a little deeper to why these labs may be abnormal.
You got to get a lot. Look, you're going to drain you of your blood.
Yes, I know. It's a
times.
lot.
Over a 12-month period.
Yeah, it is a lot. Yeah.
It's all right. It's worth it.
Yeah.
I mean, I'm telling you, when you're desperate enough, I've been desperate enough. I would have done anything. You
Well,
beat
maybe-
me with a stick. Okay.
I don't know if, like, okay, so how often do you get patients who come to you and say, okay, I've been taking Zoloft for 15 years and now it's no longer working, so I need to figure out something. Do you get this type of scenario?
Yes, I do. And then again, it goes back to the basics. What am I working with? You know, are you prone to something in your genetics that makes you prone to mental illness? So we got to find that out first.
And do you find that it's mostly the genetics that makes you give them a different plan, or is it more like the whole picture together?
It's the whole picture, because genetics is only one thing. You can have the worst genetics, but if you've had a good life, you're not going to have a lot of problems. You can have even the best genetics, but then you've had a lot of issues, then that's another thing that we need to look into. So
Physical trauma, mental trauma, those things have an effect on even those with good genes.
yeah. And even then,
I mean, all of our genes are good. Don't get me wrong, Mom and Dad. I'm not. I'm playing. I'm serious. People can get like. I know. I got a kid that what he just went through, and he's got my genes.
I didn't want to get technical here, but that's actually an interesting point to me personally. So I hope it's gonna be for others too. I always tell people that there is no such a thing as bad genes. Like you kind of get into this a little bit. Like, so would you explain a little bit to listeners who wanna geek out on like what the environmental factors actually do to genes, is how this turning off and turning on thing works that we keep hearing all the time?
Yeah. Sometimes it's toxins that can turn on, bad genes. When I say that, I mean, if you are deficient in your ability to make serotonin, dopamine, norepinephrine, and then you're under a lot of stress, then you're asking your brain to do more than what it can do. That's an issue. And I started really looking into the immune system. Let's just say, you've had depression all your life, and maybe it was toxin related. And are you a person that has difficulty removing those toxins? Are you also a person who's highly prone to inflammation? Those are the new things that I've learned in trying to analyze somebody's genes. I can explain a little bit better why they are in their state.
I see.
Yeah.
So go ahead.
Is this a good time for you to like tell my story?
That's exactly what comes right here.
I would love. All right, so
tell me.
For everybody, I'm gonna let her explain me. And then people have. I mean, I was contacted by someone that I hadn't seen since my 20s. I had periods of 5 years through my life where I would move completely across the country, change all my atmosphere, change my friends. Everybody was new. I did that because of the memory issues I had. No one knew that. I didn't tell anyone that, but I was working. It was amnesia I had, and I just feel like amnesia has a lot of dementia related because I had it at 17, and then it would keep coming back, and I would just like lose connection. I might not lose the memory of the things I did, but I had no connection with them, or no emotional attachment to people, and so I had someone just ask me last year, or didn't ask me, said it's starting to make sense now. One of the people in my youth group, I was a youth pastor right before I became a rock and roller. And
it's a hard shift.
Yeah, I went from suit and tie at a Pentecostal church to tattoos and a guitar and screaming. Pentecostal preachers scream when they preach anyway.
Yeah, different kind of scream.
So, hallelujah. So anyway, here's your answer.
So take him as a real life example. Yeah. And so what did all of this testing and learning about his past history reveal to you?
Yeah, you have a colorful history, but but obviously, cases of head injuries and mental health issues, substance abuse issues. I like to ask my patients actually, like, how do you feel when you use alcohol or drugs? That tells me more, about like why they would do that. And then I can guess, what's going on with their genetics. Let's take someone like you. You were born with a deficiency in the MTHFR, enzyme that cannot metabolize folate to L-methylfolate, which is the activated form. So that becomes serotonin, dopamine, norepinephrine. On top of that, though, I call it the double whammy because the little dopamine you do have, you metabolize it super quick.
Is that why I could do cocaine lines that big and then come back and say, give me 2 more of those?
Yeah.
Why? Is it why he was hiding Oreo cookies in his drawer when I met him?
Was I really?
Yes.
Why? I didn't.
Yeah.
I had no one to tell me that was bad, and I'm hiding them.
Well, I told you, but you forgot about it.
Yeah, the dopamine seeking and so forth. I mean, the history of like going from here to there that shows impulsivity. And then you were just compensating for the fact that your memory is not that good. It's because of you were already prone to poor memory because of the low dopamine, and then tack on the drugs, alcohol, and the head injuries, you've just, really, really hurt the brain and its ability to function the way it should. Yeah. But you did not have the knowledge that this is what's going on and this is what you need in order to make sure those things in the brain are functioning or at the right
I was
level.
doing my best to feel good. And the only thing, I knew something shifted in my 20s, and I felt depression through sadness and a divorce turned me, and all of a sudden I didn't have joy anymore. And then just one day, a guy that I hung out with through work was drinking, and we were doing a show where we sold some stuff at for a bike show, polish and stuff. And he handed, hey, let's drink it. I'm like, okay, no problem, man. And so the more I drank, the more I sold. I was like, my personality came out, and I had no idea that I could drink and have this much fun and be this good of a salesman. And so I started drinking to feel good.
Yeah.
And then, of course, I found pain pills, and I'm like, what?
Dopamine seeking again.
But what the problem was, I mean, like everyone else, be like, take one of them. I'm like, okay.
Okay, I'll take 2.
And within an hour, I'd already I had just taken them. I'm chewing them up, and I was trying to snort them, and then shooting them up, and it just went on and on and on. But I wasn't partying like I mean, I was for a few years, but I mean, I was really trying to feel good.
That normally people think, and I think that's why the shame is associated, you know, with the drug use, is that they're just thinking that you want to party, and that's why you're doing it, and it's very, very little understood that we are trying to self-medicate for, a good reason.
I mean, when you're a young person, a lot of young people don't have a whole bunch of trouble. Now, there's a lot of young people that do, but there's a lot that don't, that just party their hind ends off. And then they quit and move on about their life. Right. Those that hang on to
grew out of it.
They never did grow out of it. They're the ones that are hurt and they're crippled and needed something.
Yeah, there is a genetic predisposition for that. So, self-medication is one thing they do. Because I don't blame people who do these things because that's all they know. But, now that they come to see me and I really explain to them, these are the reasons why you have to take more natural things to make those missing neurotransmitters.
There is no better high than
is
the
that
natural
difficult
high.
to do in I know that probably the patients who come to you, they know what you do, but is it difficult for you to show people that the reason why you're doing this is because you're trying to feel good, and if you do this program for 6 months, 12 months, however long, you're actually going to feel great without all the side effects?
There's no better feeling than feeling good without something.
Yeah. So some people get impatient and they can't finish the program, and I do. That's why I tell them it is a year-long commitment, and sometimes I don't always get it in the first year. We have to keep going until we get it right. But every patient who does complete it that far into the program, they are already seeing some signs.
They want to keep going.
Yeah. So you want to tell me what signs are you saying you want to keep going?
I personally felt the reason why I was cocky all my life, because I had a brain that was unlike anything I'd ever seen. I mean, the brain I had when I was young is so intelligent and super detailed about everything.
Organized,
collected information that was other people didn't collect, the details that my brain collected. And then able to communicate it. I could communicate with folks in such everybody would bring their stuff to me. That way I could say, look at it this way, because I could give them a different view of it and see things in a better light. But I lost all that over the years. And so I got that back this last year. I felt it come in, and I'm ready to get even better than that. You better watch out. You're not going to be the smartest person in the family.
I'm not afraid.
Yeah. And, the good news is you're taking everything that was required of your genetics and your labs and your nutrition, and also working on getting the brain healthy.
You constantly worry about his safety. Then why aren't you worried about this? Protect his brain. Prevent CTE. Learn more at stopcte.org.
And all that comes together because there is not one magic pill for, what I do, because people are different and complicated already. They're dealing with all kinds of trauma in the past. They're dealing with illnesses. We have to take all that into consideration. But the moral of the story is, it's still about getting the brain healthy. We can get the brain healthy, but we need to figure out how to get it healthy. Like if people who have methylation problems, like MTHFR deficiency, they have difficulty removing toxins. So if
that's something you gave me, immune detox.
Yeah, that's another one. Especially for someone like you, because I think you did have quite a bit of like inflammation.
I
Yes.
still do.
Yeah.
I mean, it's not as bad at all, but
Yeah.
like I had it all over me. Everything hurt.
Yeah.
I have 27 fractures, and I always tell everyone I got arthritis in every bone. It's like a joint.
Yeah.
Every crack on my body feels like an elbow full of arthritis.
Yeah. And I really think, too, that inflammation can go to the brain, cause neuroinflammation, and that can interfere with anything that I may also do for patients. So I just have to tell them, you got to be patient. We have to do things slowly, and eventually you get there. Yeah. It's hard. But that's what we're here for, to tell them to keep going.
No, you found out that I had dairy issues, Hashimoto's, right? Through the genetic tests.
No, that's through the labs. That's from part of the Gordon protocol.
Oh, the Gordon red flags, biomarkers.
Yes, yeah.
That's important.
Yeah, so this is why we have to look at the genetics and look at the labs, look at the hormones, and come up with a plan.
The labs are the thing he worked on for like 14 years.
Yeah.
And did you met him at a convention or?
It's funny because I didn't know really anything about him. My brother saw him on Joe Rogan, and then I don't know, he found out that he created this protocol with the Millennium Protocol, so we signed up for it. And he called us.
Oh wow!
Yeah, and I didn't know my brother was talking to him.
So you were basically already trying to figure out what he that's
well, I
wonderful.
signed up for the program, to learn more about that. I didn't realize it was a whole AI that he created. So this is where I talked to you earlier about this. Like, AI is a tool, but you still have to have the brains to figure out like what AI you need. And then sometimes even the results may not always reflect what I do for patients, because he also taught me to treat the patient.
Yes.
Not the labs.
I mean, you can get a wrong,
Yeah.
An incorrect lab result. And if you're not paying attention to your patient, then you can go off completely on your plan because...
Yeah. And so that's very important. Okay, let's just say, for example, you're a person with like low growth hormone markers. And, growth hormone is very important for, I say, recovery, sleep, metabolism, so forth. But if they don't have any trouble with that, then I'm not going to treat that. Right. So, then we move on to the next thing, like if they have like, and he's always like this, where you have to get things to the middle to try to see how much improvement that they get, because everybody is different in how much they need. Females, for example, are very, very interesting because
I think so.
Thanks.
When it comes to hormones. Seriously. So
yeah, that's a good one.
So the whole point is, there are some females who require a higher level of testosterone, and that's okay. And that's okay, so long as they're watching the labs and making sure they're safe and they can continue.
As long as you listen to them, right, and ask the questions, how do you want to feel? Because obviously that's gonna be in line with different personalities, right?
Yes, and when you say that, like, I had this patient. She was very active, and she got into a bike accident, head injury. She was depressed for several months, and so like, her wife was my patient, so told her, you need to go see Dr. Damayo. Yeah, and we did, ran the genetics, ran the labs and hormones, and I'm giving her like HRT, but it helped her recover from that injury. and he got her up to
What's
do things,
HRT? Human?
uh,
No.
hormone replacement
Hormone
therapy.
replacement
Yeah.
therapy. Okay.
So, that's a general term. But like, I had her actually on actual prescription HRT.
Oh, wow. Okay.
Yeah. And I saw her like, I don't know, last week, I think. And yeah, her labs were a little bit higher, but she's like, don't touch anything.
Oh, wow.
I feel good. I'm gonna, she's going out and doing things instead of
Awesome.
sitting at home feeling sorry for herself. I said, I'm not gonna change anything.
That's awesome.
Yeah, because it's all about what the patient responds and how they're feeling.
Yeah, absolutely. And that's beautiful, because I really think that, if we can say, like, really shortly what's missing from Western medicine, it's just that attention to the person. That, it's not just the numbers, but there is an actual person, and you kind of have to consider the whole thing. It's a whole package.
Yeah, exactly. Because early on, and with me doing HRT, I had some women who were really high testosterone when I come back out to treat them, and I knocked them down, and they did not feel good.
They don't like it.
Yeah, I said, okay.
Awesome.
We'll get it back up to where it is and get you back feeling good again.
So knowing that you work with this protocol, with protocol of Dr. Gordon, I should say, like, how would you describe what it added to your work, like how it enhanced it?
Oh, I always knew that hormones was the last piece of the puzzle for anyone. I just didn't know how to approach it. And I'm so glad that I met him, because otherwise I would have learned it the wrong way from someone else. His focus was mental health and hormones, which is very, very different compared to other people, because his focus was traumatic brain injury and how he has this patient, Andrew Marr, who was I don't know.
Yeah, the Green Beret.
Yeah, he was on so many meds, and then, he asked him to come in and get at least testosterone treatment, and it just totally changed his life.
Yeah.
Quit drinking, got off all the psych meds,
Wow.
and doing good.
You know that I always was a big dude. I lifted weights and I was strong as an ox. And then in 2009, my testosterone tanked. I had the accident where I had my head really bad in a head-on collision in 2008. And so that was the first time in my life I ever felt that testosterone disappear feeling. And I was just, and I had no energy and no strength. And, but that's an important thing that I think a lot of folks with traumatic brain injuries, they don't know anything about that, because the doctors never said a word to me about it. Even when I was down, they wanted to give me testosterone shots.
Your mom told me that after your 2008 head-on collision, you had at least 7 to 8 suicide attempts in the first 12 months. So I actually want to talk a little bit about that, and I'd like to hear your clinical experience with how neuroinflammation plays a role in that.
Yeah. Okay. I was like,
I'm sorry about that. Sorry, Karen. I remember that I had a suicide attempt and waking up in the hospital, and my mom's so excited they got an answer why I'm doing this, and it was my thyroid had stopped functioning. So that's gonna fix you. They put me on levofloxacin or whatever.
Levothyroxine.
Yeah, worst idea in the world. Because
In his clinical opinion.
it just kills your thyroid.
Yeah.
So
yeah, right.
I heard Gary Brecka talk about that, and
Yes.
I'm like, dang it! No
Yeah, he
wonder I
explains
don't
it
respect
pretty-
doctors. I'm getting respect now.
I'm glad you're giving us a chance.
It's coming back to me. I always say you want to, just live long enough. You might have an opinion of something negatively, but if you live long enough, it can change. Just give it time. So it has. I respect you guys now.
Thank you. I appreciate
You
that.
and
Yeah. That's why we do 28 biomarkers just on hormones alone, because
When you say 28 biomarkers,
labs,
That's
just
a
for the
lot of-
neuroendocrine system.
that's why all that blood's taken.
Exactly. On top of that, I add a little bit of other stuff, but that's the whole point. We want to know if there is a hormonal deficiency. Is it coming from the brain? And what you brought the point. I'm like, yeah, you've had low T, and you had this brain injury because of inflammation. It starts to attack the parts of the brain that controls the hormones, so it does not respond to if you have low T, low testosterone, and that's why we use before we even reach for testosterone, we try to get the brain to start functioning again or help it along. And that's why we use the medication clomipene, because it acts like a testosterone stimulator. And you can probably not have to even give testosterone to men right away, but use that to promote the body's own, synthesis of it.
So for all of our listeners that are going to the doctor, I know it. They did it to me. So I know they're doing it to thousands and thousands of other ones that are giving them testosterone shots. They did it to me. The downside of that is your body stops producing testosterone.
Right.
Yes.
And then, so you're killing your your testosterone maker. So you're going to be dependent on Cypionate or whatever it is they were giving me. I think it was Cypionate in the shots. And that kills, it's just like the levothyroxine or whatever that's called. What is it called?
Levothyroxine.
Levothyroxine. I was close. I took that for 8 or 9 years. And my thyroid came back due to a miracle that Fru pulled out of these singing bowls.
Bowls.
That's pretty
She did. That's a good story.
Yeah, but did they ever tell you that maybe it was inflammation
Nope.
because you have Hashimoto's?
Not one time. No, not once. That's why I want you to explain it, because there's thousands. I talk to them all the time. They're going to go do what the doctor says.
Right, and they really don't understand
They don't understand
why
it.
they should,
Because the doctor won't tell them that.
why they should treat the root cause rather than just the symptoms. That's important to hear from. We talk about it a lot, but your credentials are going to be more powerful here than our personal experience, I guess.
Yeah, the goal is to try to get the patient to those long-lasting results that they've been looking for.
Yeah.
So, even you talk about thyroids, you have Hashimoto's. It's really a sign of inflammation. And there is a correlation between Hashimoto's and vitamin D deficiency, and you're very low in it. So we're still working on bringing that up. And, there's some people that can't make D or absorb D and so forth. So that's a genetic issue. I can't recall what yours was, but maybe it has something to do with, nutrition. But the whole point is vitamin D is an anti-inflammatory, antioxidant hormone also as well. So if that is not where at the level it should be, you are going to be prone to inflammation. So that's why we have to support all your antioxidants, the C, D, and zinc. That's why we check those things to make sure.
And to get back to the question that didn't get answered, what does that do? What that neuroinflammation is going to do to somebody who's showing suicidal tendencies?
Oh, the whole thing is inflammation itself can totally disrupt how a brain works. It can deaden the cell, like you don't have enough ATP production, and then you don't make enough neurotransmitters. So if you don't, and then the whole thing about with the brain injury and inflammation, you become also deficient in your hormones. So it's this whole picture.
It's going to change completely how you feel, right? I mean, if it's not clear enough for people that's why somebody's taking their lives because they don't feel themselves, then I guess they just have to take your words.
Right.
Yeah. Yeah, and then you also still have to look at their cholesterol level, because if you're low cholesterol, then you can't make enough hormones either, or you can't have enough healthy brain cells, because the brain cells is a lipid layer. That's what protects it.
Right.
So it's not an easy answer why people get suicidal, especially with a brain injury, but it's all those things. That's why
I say it's my cells, they're in such a battle with all the toxins.
Yep.
Trying to survive.
And they were created to take out what's causing us to be ill. And so I said, it's us. We're the one eating the wrong food, and so the cells are stressed out and hopeless. So they turn on the body and take this guy out. He's the one killing us.
But you
That's
know,
what I say.
but
I don't know
that's
if that's true or
that's
not.
where usually people get offended. So
Yeah, I
let
know
me
it.
let me say,
Fix it,
well,
sure.
yeah, let me fix it a little bit. So the moral part of it is really that when you don't feel right, you keep sending this message to yourself that you don't want to live anymore. And so, you know, if you, like we're talking about like oxidative stress and things, you know, that influence how your cells work, imagine what kind of stress your cells are going to experience if you keep sending this message to them that I don't want to live, I don't want to live, I don't want to, you know. So that survival mode is it needs both the biological and that emotional and mental component too, where you have to feel right and you have to feel like this life is worth living. So would you agree with that, or would you?
Yeah, you still have to be able to know like what's causing that. You know, obviously medications wasn't the answer because there's lots of people out there with tons of meds and didn't do anything, and there is a huge correlation. Even veterans, high risk of suicide. Why? Brain injury, blast injury, those kinds of things.
And you don't know what you don't know. So that goes back to your example where you don't know that, eating Oreo cookies 6 times a day is going to make things
Right.
work. So
My, my cells are like, turn on this dude. He keeps trying to kill us. My body's fighting itself.
Yeah, the body is an amazing machine, and it was created to work with nature. And you're putting things that, let's talk about like preservatives and, processed food. It doesn't like that.
Right.
Doesn't like that. So it kind of sees it as inflammatory too. At the same
And then
time.
also the factor, that comes to mind to me right now that your gut is sending signals backwards to your brain also. So like when you're putting all those toxins and your body is working really hard to get rid of all of those toxins, what kind of signals is it going to send back to your brain?
Yeah. Well, the whole thing is if your gut is not healthy, then your brain is not healthy.
Right.
What's in your gut is going to your brain.
Right.
So if you're eating bad stuff, some of that stuff permeates through, especially when you talk about seed oils and omega-6. It is neuroinflammatory. Your brain is trying to figure out how to make brain cells. And
Right.
so sometimes it winds up taking in too much omega-6 to compensate if you don't have enough
Is that the
omega-3.
most overlooked, would you say, in nutrition, the most overlooked part of the oils? Because I feel like everybody knows about sugar by now, or most everybody.
Yeah, sugar. And still, I mean, people are, believe it or not, even in Florida, I can find people with vitamin D of like 7. And then, the minimum you should be is 25. Even that, I'm not happy with patients.
Yeah.
It's also a genetic thing too. So we have to look at all those things that is important in trying to help address inflammation. Yeah, and there are people that have difficulty removing toxins, people who have run low in glutathione. Glutathione is in your liver. That if you know anything about Tylenol toxicity, that's what they give is N-acetylcysteine that becomes glutathione. So that's a way of getting rid of toxins in your body. And there are some people who will go out drinking and they're scientifically aware. They will start to take some glutathione in order to, detox the body with alcohol. I wouldn't recommend that, but,
Right.
That's how the body, the liver, detoxes and gets rid of it.
Well, that's actually why we like to work with the supplement that we use, because instead of taking glutathione, it helps you to increase glutathione, indigenous glutathione, which is now I heard it's becoming more of a problem that people have high glutathione, and that's being a master antioxidant. The body wants to use it, so like it's not gonna be like, oh, I don't need this, let's just get rid of it. It's gonna be like, let's do this. We got all this glutathione, and so it hurts people.
Yeah, the whole point is don't try to put poisons in your body. Maybe you don't need as much glutathione.
Yeah, right. I agree.
What can you say? Explain what Hashimoto's is.
Hashimoto's is okay. It is a thyroid disorder, and it's an interesting one because it's like you can either have normal thyroid or you can have low thyroid. So the whole point is the body sees your thyroid as foreign.
As an
So
outsider.
the immune system starts to attack it. So that's why when I do see that in patients, like where your thyroids are good right now, something is triggering that immune system to start attacking the thyroid. And sometimes it is related to vitamin D deficiency. I have seen Hashimoto's go away once I start.
We're going to
loading them
see
up with
mine
D.
go away. I know.
I hope so,
Yeah.
but I don't know. It could be something else with you.
We'll get to the bottom of it.
Yeah, so that's the whole point. It's not normally people test for that, because the whole thing about inflammation in mind and body, it's we don't really take into account, as providers. So we have to take it more seriously. Like, what is the cause of all these chronic disease?
Yeah. Yeah, especially, I think of vitamin D deficiency when you say that. I know that that's so typical across the board. Like almost everybody is vitamin D deficient. I lived in Denver, Colorado for 13 years, where there is 350 sunny days and still people are low on vitamin D.
Yeah,
it's just
same thing in Florida. I see these, when I used to work in the hospital, they have these like homeless people, they're out there in the sun all day, but their vitamin D is in the tank.
crazy.
And, vitamin D is also helpful with depression.
Yeah.
And so, but then again, it's like also it helps with cutting down inflammation. And it's just a whole cycle that we have to think about, So, yeah, I tell my patients, eat right. If you want to feel better, I can give you the best medicine, but if you keep putting poison in your body, it's not going to, it's not going to be helpful for you in the long run.
Right. What do people normally notice first when they get started on your program as they, start to feel better? Is there a typical thing that you could name?
Yeah, it's so sad. Some of my patients that come to me that they've never felt good for decades.
Wow.
And
Yeah. Thanks,
so,
David.
And if I was on the substances, and then I couldn't, by the time I met her, I couldn't feel good on a substance. I just had to get blacked out. Like, if I come to, I'm like, lucidity, nah.
But it's interesting because when I met him, to me, it seemed like you always felt good. And then the only time when you
just
didn't feel
masking
good was when you were drinking alcohol. And I'm like, okay, so why are you drinking?
Yeah, isn't that wild? I masked. Nobody knew what was going on with me. I didn't mean to, but I also was not. I was operating blacked out a lot of times. Not even drunk, or on any drugs. I just would not know I'm there.
Autopilot.
yeah.
And so my autopilot was a happy dude.
Yeah.
I had always been a happy guy no matter what. And I always was strong enough to get through everything. I had a positive way of looking at stuff. And it just carried on into my 40s. My 40s is what it started showing up. I lost the ability to react, like control my reactions. I couldn't hide anymore. And so then it started showing up as I'm a psycho and going to jail and
A little too much.
overdosing left and right. Yeah, you knew how to deal with it the way you did, but now these are the things you gotta do. You gotta take care of your brain, take care of your body, make sure you supplement, because based on your genetics, you're prone to mental illness and ADHD. So that those are, and sometimes people, impulsivity, and sometimes everybody gets diagnosed bipolar. And I don't like that diagnosis as much as I used to, So I would like to know why. There is a genetic predisposition for it too. Like for people who have low brain-derived neurotropic factor, they have a genetic deficiency to not make that much. And believe it or not, lithium can increase that.
That's lithium orotate? Or
Yeah.
Yeah, that's when you put that on me. Would you? It's a supplement,
Yeah.
y'all. But in the psychiatric world, lithium. There's a thing called the lithium shuffle.
Yeah.
And I've stayed in the hospitals
I
a
don't know
lot.
anything about
Okay,
it.
well
Yeah.
I could stand up and show you how it goes if I could walk across the room.
So, it's important that
What is that difference in the psychiatric lithium and the supplement that you give?
everybody needs lithium in their body. That because of our diet, we have lithium deficiency. But I use it also to treat people with brain injury who tend to run low in brain-derived neurotrophic factor. So it's interesting that in my training, attendings would say, the only thing that she would respond to is lithium. I said, again, this person's bipolar. I said, well, maybe it's because the fact the brain is not healthy and the lithium is increasing those proteins to get the brain healthy. So, there is, in a way, when people have a low brain-derived neurotrophic factor, it sort of is the bipolar gene. But I don't like labels,
I understand.
I got a disability check because of it, though. It does something. Point. Oops, thanks. I'll take a check for that, please. I'm bipolar 1 disorder,
Yeah,
polysubstance abuse.
They
too.
have to put a label in
Like a
it to try to.
polysubstance.
Right.
I was like, that ain't bad enough. You're going to call me a polysubstance abuser?
Well, yeah, sometimes I think people, we talk to a lot of people who are like, but is there a diagnosis for CTE? And I'm like, can you shift a little bit and realize that maybe the diagnosis is not as important than fixing the things in your life that will help you to get better, and they don't like it at all. And I think, please tell us what your thoughts are about that, because what I'm trying to tell them is what I learned, is that a diagnosis, the purpose of a diagnosis is to provide better treatment. So what's the point exactly to get a diagnosis for a condition that we don't have a treatment for?
Yeah, the CTE is really just another syndrome, and it's explanation what causes that. So, but there's a reason why they become that. It's because of all these things that's gone on, the repetitive head injuries, genetic deficiencies, hormonal deficiencies, that. So in a sense, CTE can be treated, but we need to know what the person's biology is.
It can be treated when you're treating the root cause.
Yeah.
Right. So if I go to a Western medicine doctor and they offer me, a diagnosis for CTE, then what are my chances that I'm going to get better?
Yeah. There is some truth that people who have chronic, traumatic encephalopathy, they are prone to dementia.
Yes.
And I've been starting to test my TBI cases for the proteins, and they're positive. And if they don't have a family history, but I think that's probably what's happening is the CTE that's causing that dementia. But, we're going to work hard at trying to get to that point where we're going to get the brain healthy and start to work, and then bring the, support the immune system.
I'm so happy I'm a part of this. I'm telling you, it makes me right. When I went to the doctors, that's what I told them in the beginning. I'm like, you guys got it. If you're smart, you'll spend more time with me and write a book about it. Because I got something. You study this out. Because I'm going to win. I'm a winner. Even when I was suicidal, I was winning, because if I died, I got to heaven first. The Bible says those who are dead in Christ shall rise first. I'm getting up out of here. And, there was a point in my life where that's all I could look forward to is dying. And now I don't feel that way at all.
Hallelujah.
I'm so happy about
Amen.
I look, when you have a belief in a higher power that is eternal, then it only gets better when you die. To live is Christ, but to die is gain. So, I look forward to the other side. But, man, there's heaven on earth. When you feel good and you got the right environment, and you can change your environment by what you can change the reality in your life.
Yeah.
By how you see and view things.
Yeah.
That's why I say you can change the whole world by how you view it.
Yeah.
You just change the way you look at the world, and the whole world's changed.
Yeah, it's important also. Yeah, we talk about putting bad things in our body, but what are our relationships like? If you continue to be in a toxic relationship where you're berated and beat up, and that's not good either. You know, you got to get yourself
Gotta
out
change
of
that stuff.
that. Yeah.
So for those, you said that the most, you hear it most often that people didn't feel good for like 20 years or whatever. Like, I know there are a bunch of people listening this right now and they feel that way, even if they, you know, didn't put that into words. What would be your suggestion for those people?
Well, they need to find somebody who will be able to do a deep dive on what's going on. And yeah, I didn't finish that thing where I said about like patients have not felt good. It's such a rewarding feeling to hear them say, for the first time in my life, I actually feel good.
Yeah.
Yeah. And then, you know, some patients will say, man, I wish I found you sooner.
Yeah.
But that's the whole point of what I'm doing is I'm going to get to a spot in my life where like I'm finally going to finish also my Brainwell University so other people can do this. You know, I'm only about 20% in. But
You just got to live long enough, don't you?
You know, I work, you know, like full time, you know, like anywhere. I can see up to like almost like 18, 20 patients a day sometimes, you know, in what I do. And so I'm just glad I don't work for the hospital anymore. So like the weekend, I get a chance to actually sit down and breathe and actually think about creating my program, you know.
And now AI is out. It's what a helpful tool.
Yeah, AI is good. AI, you know.
It's helping me with my movie. Like all the I got so many terabytes of documentation since 2006 in digital.
Yeah.
All the other stuff was all analog, written down, but now that AI can listen to the videos and the audios and listen and transcribe it, put it in time frame. I mean, help me incredibly to bringing that into a movie.
Yeah, and we are gonna get to that point too, where like it'll be, because right now I'm doing everything manually. I'm looking at things, I'm thinking methodically, but it'll get to that point where I can be able to create a software that can just run everything in there. Then I can review it, whether I believe it or not.
Right.
You know, but right now everything is manual. You know, trying to perfect protocols. So I'm still learning. You know, trying to perfect things and. You know, okay, I've tried everything. Why is it this patient is still not, you know, doing well? So
there's still personal touch. Still got to have the personal touch. Everybody's different.
Well, and
Everybody's
you know,
their own person.
as long as new information is coming in, it's gonna be that way, right? You're always gonna, because I guess one of the biggest problems with education in the medical system is that it's so outdated. Like it's like nobody's.
You know, as long as there's a God,
yes,
people are going to be different. He likes different people, and none of us are the same. Not one thumbprint.
Well, it's definitely not everybody has the passion like she does, you know, for helping people. So, and I would definitely like to, you know, thank you for doing all of that for us.
Our house thanks you wholly.
Yes.
WHOLLY.
Yes.
well, people like you guys that keep me going. You know, just having that feedback to say I'm going the right direction. And then, like, I know we don't really talk about religion, but I really believe that this was handed to me.
Yep.
Because, I mean, I'll admit it, I was like, I wouldn't have known anything from Adam. And things were put in my place.
We believe it.
Yeah. And
we believe it.
you know, I mean, to be mentored by Dr. Mark Gorda, and I was just like, who am I in this little town of Punta Gorda? Right. He took a real interest in me. I was like, really? You know, you want to talk to me and help me?
Well, I guess he paid attention to the details too.
Yep.
Sure.
God has a way of putting the right people in your path.
Yeah.
That's for sure.
Otherwise, I would just be...
And he does that to the right people, by the way. Not just everybody. You are picked out and chosen.
Yeah, it's I am humble. I'm in awe of how far I've gotten in my career and my knowledge.
A peculiar psychiatrist. You are a royal priesthood.
Well,
a chosen generation.
So don't worry about the ones that they think you're a floozy. They're just jealous.
Floozy, a flake.
Flake.
A flake,
you know,
a flake, not a floozy.
Not a floozy?
No, not a floozy.
Okay, never mind.
it doesn't matter to me. If I help my patients, I help my patients. That's all it matters.
If you have to be a floozy or not.
I don't know about a floozy.
Okay, got that.
That's my
Hungarian
Desi Arnett,
co-host,
Desi
co-host
Lucille
here.
Ball thing.
So where can people read more about you? I mean, I know that Paradise had behavior and they can find more about you, but what you do and like the program that you work with, what would be a good
Well,
place
they
to
can
find
just go to paradisebehavioral.com/brainwell. And in there should be some links to some videos,
We'll put that in our links.
Yeah.
And
So-
and on your website, are they also going to find details of like the genetic evaluation or like
Yeah, a little bit of that, just an introduction to what we do.
Okay.
But the Brainwell page explains everything. You know,
Okay.
like, we do the genetics labs, find the root cause, and and then if you want to be a patient, you just put your name there and put an order in, and then we'll call you and get it started.
Make sure you say we sent you.
Otherwise, David is gonna come and have a talk with you.
Yeah. I want her to know how awesome it is that
Well,
we are her patient. I'm her patient.
I think she knows.
She's got that book over there. Taking notes.
Yeah. It's all that matters. If you're happy and you're living life the way you should, that's the most important thing.
That's a psychiatrist. That's it.
So,
At the end of the show?
so Dr. Feelgood,
Yes,
please.
ma'am. Dr. Feelgood.
Yes. I'm gonna thank again the Patrick City Awareness Foundation for their help and the incredible work that they do for families.
Please go
like
visit them
ours.
on their website at stopcte.org.
Thank you, Karen and Doug Ziegel.
Thank you, guys.
We love what you do.
Thank you, Dr. Damayo.
Thank you so much
Dr.
for coming.
Gordon, we thank you too. We'll have to have you in here sometime. Very much so.
Yes.
Yeah.
All right, let's party.
Goodness.
That's it.
All right.
You constantly worry about their safety. Then, why aren't you worried about this? We've known the big hits are bad. Now we're learning all those little hits can be worse. Choose Brain Safe Sports. Learn more at stopcte.org.
All right.
Yeah.
That was really good.
That was amazing. That was
Okay,
fun.
somebody tell me what a floozy is.
That's a slut.
Yeah.
What? Holy cow.
He used
I'm
the
so
wrong
sorry.
word. Said flaky.
Yeah, well,
He
next
was
time.
trying to say flaky.
Yeah, that's why, yeah.
Yeah, I got that too.